Hello, I'm Casey Aiken. This is 21 This Week. Coming up next, Governor Hogan ends Maryland state emergency COVID powers. Will Montgomery County follow? Should children as young as 12 be able to see a mental health professional without parental notification? And why are Baltimore businesses refusing to pay taxes? Governor Hogan's beltway expansion plans suffer a major setback. Our panel of insiders will give you the story behind the story. We're joined by former county council member and founder of SkillSmart, a technology startup working to build stronger communities, Mike Knapp, and former membership director for the Maryland GOP, Phil Bell. Stay tuned for these stories and more on the next 21 This Week. Maryland Governor Larry Hogan announced that effective July 1st, the COVID-19 state of emergency orders will be lifted. In his public announcement, Hogan stated, "We have finally reached the light at the end of that long tunnel. While the end of the state of emergency is an important step in our recovery from COVID-19, it does not mean that this virus and the variants no longer pose any threat." What does this mean for Marylanders and Montgomery County residents? For example, there will be no legal mandates for face masks in any setting, including camps, childcare facilities, and schools anywhere in the state. Or does it really mean anywhere in the state? Mike, this comes as good news for Marylanders, but in the past, we've seen Montgomery County be reluctant to follow the state's lead on such matters. Will Montgomery County follow the Maryland Department of Health COVID-19 requirements?
That is a great question. I think that they should. I think at this point the state and the county and the other jurisdictions can really all declare victory. I think the state and the counties have worked very hard, and they've done a great job of really ensuring that their populations have been vaccinated, and we've achieved the levels that we're hoping to try and get to. And I think the result is that we should begin to relax the requirements that we've had out there. The interesting thing is that I've seen is even in places where people don't have to wear masks in Montgomery County, many people are still all wearing masks. And so I'm intrigued to see at what point, whether there's a requirement or not a requirement, that people just begin to let their guard down and recognize that they've been vaccinated, and so is everybody else, and the numbers are in our favor and things are okay.
There is definitely a reluctance for people to give up their masks. I see it in different parts of the county as I'm driving around. So anecdotally, I agree with you, Mike. It'll be interesting to see how quickly things seem to return to normal. Phil, according to an article in the Washington Times, the COVID-19 lockdowns decimated small businesses across the country. And the New York Federal Reserve reported that nearly half of Black-owned small businesses had been wiped out as a result. Now that all of the restrictions have been lifted, are Black businesses going to be able to rebound?
Well, Casey, as you know, it doesn't matter much to me whether we're talking about Black businesses or anything else. What matters to me is the principles. What matters to me is the opportunities. That is what was taken away from us in such a great way. And one of the things that's irking me the most is that as we talk right now about the happiness with restrictions being lifted, we're forgetting about all the problems that happened in the first place. You know, I read an article the other day in Town Hall which talked about children who went to school and had their new face masks, new or recently laundered face masks tested. Those had staphylococcus, meningitis, and all manner of other dangerous, scary viruses in them. It's basically like wearing the bottom of your shoe on your face. That's the sort of thing that these restrictions have led to. That's what destroyed businesses. That created so much division among the American people for absolutely no reason whatsoever.
It is a perfect segue, Phil. Excuse me, we got to cut you short for a second, because that's a perfect segue into the question I want to ask Mike, which is the news service Vox posed the question this way: California mandated masks, Florida opened its restaurants, but after a year of debates over mask mandates, lockdowns, and school closures, there's mixed evidence that might suggest fatalism. Did none of the state policies really matter? Or was the virus going to spread no matter what the states did? Was it all, as Phil might suggest, for nothing?
No, I don't believe it was all for nothing. Was the virus going to spread? Yes. But did wearing masks keep it from spreading more quickly or more badly, and for us seeing more deaths than we would have seen? Yes. Is there,
Well,
is there
Mike,
other
what is that
results?
based
Are there
on?
mixed results?
What is
Yes,
that
there are
based
there are
on,
mixed
Mike?
results.
Where does that come from?
Oh, where does what come from?
Where does your assertion come from? It's almost interesting.
Actually,
Just
actually
about
comes
every
from the same,
day,
comes from the same
there's a
article.
new
It comes from the same
study.
article that
So
Casey
Denmark
just
and
quoted.
Germany so far, we've seen what happened, that they had zero impact. University of Louisville, the same thing, zero impact. So please, where is your assertion coming from?
My assertion is actually coming from the same article that Casey just quoted from, where it actually goes through 3 different places and 3 different health professionals who said that the masks actually did work, especially in closed environments. And the reason that we're seeing mixed results is because the application of those was sporadic across all of the jurisdictions. And unfortunately,
you're going back to another famous argument of of your side of the aisle.
I'm not picking an article about any side of the aisle. I think we're actually looking at what's public health and what makes good sense. Unfortunately,
sporadic adoption is just another way of saying, no, it's not me, it's the other guy, it's his fault. That's where this is coming from, with absolutely no scientific evidence.
The other guy, yeah.
Well, I think this is the debate I think that we are all going to be experiencing, because we've all been traumatized for the last 18 months. And whether you believe that the lockdowns were beneficial or the lockdowns weren't beneficial, there's really going to be it's going to take many years to determine whether or not there's proof of it.
Fortunately, we're not at the 650,000 people that are actually dead, so we're still around to be able to have that debate. So on the plus side,
I agree with you, Mike. We can have that debate, and the terrible thing is that those people had to suffer and die. We're going to move on to our next topic. And there's nothing that strikes at the core of families more than when the government interferes with parental rights. Last week, after contentious debate, Governor Hogan allowed a bill to let minors as young as 12 years old to seek mental and emotional health care without their parents' or guardians' consent come into law. Phil, opponents felt that parents would be uninformed about their child's care and what they're going through. Why were these concerns dismissed by the General Assembly?
That's a great question, Casey. I'm not entirely sure, because obviously I don't have a insight into what the entire General Assembly was thinking, but I will say, as someone who believes in parental notification for just about everything, I can certainly see why someone, might embrace the idea. Because with some of these, it may be very difficult for young people who understand that they're struggling with something to, go to their parents and say, hey, look, this is a problem. I know, family I grew up in, if I said I wanted to see a psychiatrist, psychologist, the response would not have been, okay, well, let's go do that. It would have been, quite a bit more harsh than that. So I can certainly understand what the rationale is, although I don't think we should ever get away from having parental involvement, because the parents are the best help for the child.
Well, I guess, Mike, that's where do we strike the balance? I mean, isn't there a concern that young people might be unduly influenced by healthcare professionals in decisions that their parents might oppose? I mean, if we're going to allow the minor to receive guidance from healthcare professionals, when do we involve the parents into that decision-making process?
I think it's a really good question as well, and I think it's an interesting challenge or an interesting opportunity. And I think I was intrigued by the fact that Governor Hogan's response was looking at how do you provide access to children to be able to have those conversations in a situation where the parent likely will be opposed to it, because we know that our children right now, especially coming out of COVID, or many more are dealing with depression and all sorts of other issues. And the challenge becomes, how do they have a conversation? How do they be able to engage someone to help them with that, especially when they're in an environment where that would be looked down upon? And yet, how do we make sure that there is a supportive environment for them once they actually start to recognize how to address this issue? And it's a really difficult challenge.
Well, we make our parents responsible for our children. Well, even though the age majority may be 18, the fact is parents are generally responsible for their children, for years and years after they reach the age of majority. If a child wants to make a decision that runs contrary to the parents' beliefs and what they might think is the healthy decision for their child, is government going to step in and prevent the parents from having their input on that?
It's a really good question, and it'll be interesting to see how it gets to that level, because I think what you'll see in most cases is in a situation, whether it's in a summer camp or in a school environment, where you have a student that recognizes that they have somebody that they can approach and ask, how do I think about this? How do I address this differently? If that's the case and it helps them to process the situation in a way that's more productive and healthier than they would have otherwise, in some instances, the parent may never even know that occurred. And if it helps that student because they could have a conversation they wouldn't have had, at the end of the day, that's a better thing. The challenge becomes, I think, when does that tension and when do those two elements clash? When does that parent engage and say, why did this conversation occur, and how does that come up?
Yeah, the scary part is I halfway agree with Mike.
This affects everyone. Because we've had parents that oppose their children being vaccinated, not just for COVID, but for other vaccinations, and still those decisions get overrun by government.
Right. Yeah, and that's really the crux of this, because what I don't want to do is set any kind of precedent, because, for example, abortion is big. Do you want to make it possible for your child to go and have an abortion without telling them? No. Do you want them to get vaccinated or receive some kind of drugs without you knowing about it? No. But, again, something different where child struggling with something, they don't really know who to turn to. They think they can. And a lot of cases is we think about with just our friends and family, sometimes going to that person who's outside of that circle will be helpful for that. And so that's why this might be a little bit of a special situation. But again, I also want to reiterate, I don't want to take the parents out of the equation. I don't want them to be totally uninvolved here. But I see the rationale.
Mike, any last thoughts?
No, I just think I want to make this note now that Phil and I are actually on the same page, because I'm thinking it's the first and last time in this program that it'll occur, and likely in future programs.
3:26 p.m.
Never say never, Mike. I mean, you didn't expect that when we started this discussion. So when we come back from this short break, in the post-George Floyd era, can they do acts of policing? Stay tuned. And welcome back. Phil, local businesses in Baltimore's Fells Point, mostly retailers, say they are fed up with the prostitution, public urination, and general lack of police enforcement in their neighborhoods, and they are threatening to boycott paying taxes until there is more police and better services. Why are the police refusing to do their jobs?
Well, you could look at a variety of things. First of all, the fact that just about any time in this country when a police officer does their job, there's immediate social media and traditional media and everybody backlash going for them. That's number one. Number two, Baltimore City continues to be led by the most incompetent leadership from the top down. So when knowing that you're going to be the target of ire, and you have leadership that's not going to stand up for you, why would you go out and put yourself at risk, even if that's your job, in order to do these things when you know what the response is going to be? But I got to tell you, I'm happy. I love seeing that.
With the public coming out and opposing and saying we want more policing, isn't that a good sign?
That's absolutely a good sign. And I wish that there were taxpayers all across the country who would rise up and do the exact same thing to put the politicians on notice that the gravy train won't roll forever.
So Mike, in contrast to the question that I just asked Phil, there's another report of a disturbing video circulating over a confrontation on the Ocean City boardwalk between police officers and a group of young black youths that resulted in arrests for vaping in what appears to be an undesignated area. Now, in the opinion section of the Baltimore Sun, Dan Roderick wrote and stated that the action of the police was entirely an abuse of their force and over-policing. So the question is, what is the police to do if they're criticized as they are in Fells Point for not policing, and they're being criticized in Ocean City for policing? What are they to do?
Well, I think the example in Ocean City, and again, to Phil's point earlier, not knowing what the General Assembly was thinking, I only saw a snippet of the video, but the part of the video that I saw seemed to be the police overstepping their bounds with one of the police officers kneeling and kneeing one of the individuals in the head 5 or 6 times, which didn't make a whole lot of sense. But I think one of the things that we've really got to do is, what is the act of policing? You said this in the beginning, and I think part of the act of policing has to be training our officers how to diffuse a situation and not necessarily always going in with force. And you're beginning to see this now in smaller and smaller jurisdictions where we know that there's less and less training, and they don't know what else to do. And it becomes clear that they don't know what tools to use, and they don't have the tools to use, and they haven't been trained appropriately. And so how do they diffuse a situation? And they fall back on, unfortunately, a use of force. And we've got to get past that. I think there's a critical role for police in our society, but we also have to be able to teach police how to do that in a way that doesn't require them beating up people.
But is there another responsibility here? Isn't there a responsibility of the public to respect police authority? Because sometimes these confrontations seem to take place when there is a group that wants to challenge the police on whether it's on smoking in an area where they're not to be smoking, or congregating in an area where they're not where they shouldn't. I mean, isn't that a responsibility of the citizenry as well, Phil?
But Casey, what you're speaking to isn't an issue of the citizenry. It's actually an issue of the politicians, and that's really where this issue comes from. The police enforce the politicians' laws. The politicians in a lot of these places make a lot of laws and a lot of rules, most of which really, really get into what personal behavior is. If you notice, the majority of these problems happen in big, blue, liberal jurisdictions where the government is telling you what to do. And therefore, the police do their job by enforcing what the politicians say. Is it necessary? Let me ask you a question.
I don't think it's just liberal big blue cities and states. I mean, Ocean City has an anti-vaping
not
law.
strictly, but think about it. Is it necessary to pull me over for going 40 to 35? Why is it really 35? You ask those questions. Why is it that someone's standing there and they're in a no vaping zone, but then there's a vaping zone down the street? That's really where the problem comes from, not with the police.
Okay, then we'll do away with all laws.
I'm not saying do away with all laws, but you have to be circumspect in, number one, why are we passing these laws? And number two, what is the impact of it going to be? And when you think about it in that way, as opposed to, well, I don't like this, therefore there ought to be a law, then you actually get laws that make sense, and the police don't have to do these things where they're put in harm's way of, say, bothering somebody for going 40 to 35.
All right, well, you're gonna have the last word on that, because I want to get to Mike's favorite topic for the day, which is Governor Hogan's plan to ease Capitol Beltway and I-270 congestion suffered a major blow yesterday when the Washington Council of Governments Transportation Planning Board removed the toll lane plan from a key list of transportation projects because of environmental concerns. Mike, what can you tell us about this?
Well, this is the continued saga of Montgomery County, where we don't like transportation, but we don't actually have any solutions to make transportation better. And so the challenge with this is, now, usually we do that and it's a conversation we have amongst ourselves. And so, okay, it's crazy, but we all choose to live here and our politicians can't figure out how to have the right conversation. Unfortunately, now they've gone to the Council of Governments, and this has made it a regional conversation. And so now you brought in other jurisdictions that now have to weigh in and figure out how to do this. And we're basically asking them to pick sides, and it's especially at a place where it's the biggest choke point in the region. We know people can't get across the American Legion Bridge, and now you're forcing people from Virginia and Maryland to take sides as to whether or not we should actually address what's been an issue for the last 40 years. And it's crazy. And rather than come out there with a solution, which Montgomery County rarely, if ever, does, we're right back there again. So we managed to convince everybody to vote against this. We don't have a solution for how we're going to address the American Legion Bridge, but we voted it down. And so Montgomery County is sitting right where it usually does. No solution, and transportation just getting worse.
Well, Phil, Mike hinted at this. I mean, the COG action came at the request of County Executive Mark Elrich, and it seems that Mark is just reflective of all the top leadership in Montgomery County. Is they hate automobiles and they want to punish people for using them. Is that where we are?
Well, the COG is one of the more useless groups in this area, and that's saying a lot because of this. Going back to our last point, they're the people who've mandated that it be 55 on the Beltway when clearly the road is capable of having a lot more. So the next time you get pulled over for going 60 and a 55, thank COG for that. But let's also ask ourselves this question, especially if you're Governor Hogan. Your job is to lead the state of Maryland. Your job is to improve transportation in the state of Maryland. This has been one of your signature initiatives. To let this group of do-nothings derail your initiative, it reflects negatively on you. And if I were sitting in his position, I would say, well, it's nice what that group of navel gazers wants to do, but we're actually going to build this. We're going to make it happen, and we're going to improve transportation in the state of Maryland.
Well, the odd thing here, Mike, you can comment on this, is it seems that the action that COG took really just affects federal funding of the roadway. And that if the governor wants to go forward with these plans, he can go forward with the plans, but the state of Maryland and Maryland taxpayers are going to have to pay for the road improvements and not get any assistance from the federal government.
No, that's exactly right. It does have some other, as far as EPA requirements and things like that it now brings into play. But no, the state can now go ahead. And so what Montgomery County now has done is said, great, we'll just shoulder the burden on our own. And so now we've increased the taxpayers' burden in Montgomery County for the state and the governor to move forward with a project that should go forward. And interestingly, it's in an era of trying to find some element of bipartisanship. This project, especially American Legion Bridge, was actually jointly signed off by the Democratic governor in the Commonwealth of Virginia and the Republican governor in the state of Maryland. And so it actually is a project that shows we can bring people together until they get to Montgomery County.
Well, I think it's very interesting because we do have an election coming up next year. I believe this will become a hot issue in that election as people challenge, just as it was in the year 2000, when people were on either side of whether the ICC should be built, became a hot election issue, and people who opposed the ICC lost in those elections. So I think this is a dangerous territory for our county leadership to be taking. In any event, we're going to choke on traffic until we all die, I imagine. When we come back from this short break, parting shots. Now with parting shots, Mike Knapp.
Thank you very much. My parting shot is to say a final farewell to Dr. Darian Pollard, who is the outgoing president of Montgomery College. We'll have our last board meeting with her on Monday. She's been an amazing leader for the last 11 years as she moves off to Nevada State College to take the leadership there. The county will sorely miss her. And she can go to lots and lots of events where people are reminding her of just how badly she'll be missed. But I also would like to welcome Dr. Charlene Dukes, who was formerly the president of Prince George's County Community College, who's coming in as an interim while we search for a successor to Dr. Pollard. And so sad to see Dr. Pollard go, but also pleased to have Dr. Dukes join us in a leadership role for the next 6 to 9 months.
Thank you, Mike. Phil Bell, your parting shot.
Well, thank you, Casey. In thinking about this, I thought about a lot of people I could go in on, whether it's Anthony Fauci, who has proven himself to be an abject criminal, or Deborah Birx. But this goes to Steve Cohen, the new owner of the New York Mets. Steve has done a tremendous job in not even 162 games of turning around the character of that organization. For years, it was plagued by loserdom, and that was certainly felt by all of us as fans. But right now, as the team sits in first place, looking down on the Washington Nationals, like from the top of the Empire State Building down, it just feels great to have new ownership, new leadership, and a new day in New York for the Mets.
You know, the wonderful thing about Mets fans is that they love to count those chickens before the eggs are hatched. So
the only time we can do it.
we're not at the midpoint yet in the season, Phil. We'll wait for the final tally. I want to thank Phil and Mike for being here today. Great discussion on some very tough, challenging topics. I want to thank the audience for tuning in each and every week to Montgomery County's hardest hitting political talk show. For 21 this week, I'm Casey Aiken.